The woman who came back from the hospital was not her mother. That is the only way Maya Ellison knows how to say it. She has tried other ways. She has tried to qualify it and contextualize it and dress it in the language of psychology and grief and trauma response. She has spent 3 years trying to find a more reasonable way to explain what she experienced in the 14 months after her mother's surgery. But every time she tries, she ends up back at the same sentence. The woman who came back from the hospital was not her mother. Carol Ellison had the surgery on a Monday in March. It was a routine procedure by the standards of neurosurgery, which is to say that it was not routine in any meaningful sense of the word, but that the surgical team had performed it many times, that the risk profile was well understood, and that the expected outcome was full recovery. Carol was 64 years old. She was a retired librarian. She had a house full of books organized by a system that only she fully understood. A garden that she tended with the focus of someone who finds clarity in physical work, and a relationship with her daughter Maya that they both described accurately and without sentimentality as close. They talked every day. They had talked every day since Maya had moved out at 22 and was now 34. Not long. Calls always, sometimes just a few minutes, but daily. A rhythm that had become so natural that neither of them thought about it as a choice anymore. It was simply what they did. The surgery was to remove a small benign tumor from the left temporal lobe. The surgeon explained the procedure carefully. He explained the recovery period. He explained the range of possible post-surgical effects, temporary cognitive changes, possible personality shifts, sensitivity to light and sound. And he explained that in the vast majority of cases, these resolved within weeks to months. Maya sat in the waiting room for 6 hours. The surgeon came out and told her the procedure had gone well. Carol was moved to recovery. Maya went in to see her, and something was wrong. She could not name it then. She could not name it for weeks. Her mother was awake. Her mother recognized her. Her mother spoke to her, asked about the drive, asked whether Maya had eaten, said she was tired and that the lights were too bright. Everything her mother said was something her mother would say. But the way she said it was different, not dramatically, not in a way that Maya could point to and say, "Here, this is the thing that changed." It was more like the difference between a recording of a voice and the voice itself. Like looking at a very good photograph of someone you love and understanding in the way that the body understands before the mind catches up that it is not the same as the person. Maya told herself it was the anesthesia. She told herself it was the surgery, the trauma of being opened, the adjustment. She told herself she was projecting her fear onto normal post-surgical effects. She told herself this for 3 weeks. And then one evening, sitting at the kitchen table in her mother's house, watching her mother make tea, she understood that she had not been projecting. Something had changed. Something fundamental and nameless had changed. And she did not know what to do with that. She did what people do when they have a thought too strange to say out loud. She said it out loud anyway. To her best friend, a woman named Priya, who listened without interrupting, which was one of the things Maya valued most about her. When Maya finished, Priya was quiet for a moment. Then she said, "What do you mean when you say she's not your mother?" Maya said, "I mean she's in the same body and she says the same things, but the way she inhabits herself is different. The way she listens, the way she pauses before she speaks. The way she looks at me when she thinks I'm not looking back. Priya said, "That sounds like it could be a neurological change from the surgery." Maya said, "I know." Priya said, "Have you talked to her doctor?" Maya said, "I have an appointment next week." Priya said, "What are you hoping the doctor will tell you?" Maya thought about this for a long time. She said, "I don't know. I just need someone to take it seriously." The neurologist was a careful man named Dr. Reyes, who had the particular manner of someone who has spent many years delivering complicated information to people who are not ready to receive it. He listened to Maya describe her concerns. He asked questions. He reviewed her mother's post-surgical assessments. He said, "What you're describing, a sense that the person you knew before surgery seems different in ways that are difficult to articulate, is a recognized phenomenon. It has a name. Capgras adjacent experience. It's not the same as the Capgras delusion, which is a psychiatric the experience a family member sometimes has after a significant neurological event in someone close to them." Maya said, "So it's me. It's something happening to me." He said, "Not exactly. It can be a response to real changes in the patient. Subtle personality and behavioral changes following temporal lobe surgery are well documented. They are usually temporary, but they can be disorienting for family members who are sensitive to the person's baseline." He said, "It doesn't mean your mother isn't your mother. It means she may be going through a period of adjustment that is affecting how she presents to people who know her well." Maya thanked him. She left. She sat in her car in the parking lot for 20 minutes, and she thought, "He didn't say I was wrong. He said there was a name for what I was experiencing. He said there were real changes. He had confirmed that something had changed. He had not told her what." She started paying attention differently, not obsessively. She was an editor at a publishing house. She was trained to notice language. She began applying that attention to her mother in the way she applied it to manuscripts. Carefully, without preconceptions, looking for the thing that was present and the thing that was absent. What she found over 6 weeks of careful observation was a list. Her mother no longer mentioned her garden unless asked. Before the surgery, the garden had been a constant presence in her conversation. She updated Maya on it the way other people updated you on their children. A plant that had finally bloomed. A pest problem. The progress of the tomatoes. After the surgery, silence. Maya asked once about the tomatoes, and her mother looked at her for a moment before answering, as if consulting something, and said they were fine. Her mother no longer initiated physical contact. Before the surgery, she was a person who touched, who hugged hello and goodbye without thinking about it, who reached across a table to pat Maya's hand when she was making a point. After the surgery, she waited. She responded to Maya's hugs, but did not initiate them. Her mother no longer used the word sweetheart. This sounds small. Maya knew it sounded small, but her mother had called her sweetheart her entire life, in happy moments and difficult ones. When Maya was being praised and when she was being gently corrected, it was so habitual that Maya had long since stopped hearing it as a word and simply received it as a signal. "I am your mother. I love you. I am talking to you." After the surgery, nothing. Maya added it to the list. She brought the list to Priya. Priya read it carefully. She was quiet for a long time. Then she said, "Maya, I believe you that these things are real.
I believe you that they're different from before. But I need to ask you something, and I need you to think about it honestly. She said, Is it possible that what happened is that your mother had a significant health event, and that you, as her daughter, are hypervigilant now in a way that makes you notice things you would previously have absorbed without registering? Maya said, Yes, that's possible. Priya said, Is it also possible that the changes you're describing are real? Maya said, Yes. Priya said, Then what do you want to do? Maya said, I want to find out which one it is. She hired a woman named Dr. Sandra Voss, a neuropsychologist in private practice who specialized in post-surgical cognitive assessment, not through the hospital, independently. She did not tell her mother she was doing this. She told Dr. Voss what she had observed: the garden, the physical contact, the word sweetheart, the quality of presence that she could not adequately describe, except to say it was different. Dr. Voss said, These are subjective observations, and the absence of a habitual word or gesture is not clinically significant on its own. But they're worth taking seriously as part of a broader picture. With your permission, I'd like to assess your mother, Maya said. She won't agree to come in if she knows what it's for. Dr. Voss said, What reason could you give her? Maya thought about it. She said, My mother trusts doctors. She would come in if I told her it was a standard post-surgical cognitive assessment that her regular neurologist had recommended. Dr. Voss said, I can't participate in deceiving a patient. Maya said, No, of course not. She went home. She thought about it for 2 days, and then she called her mother and told her the truth. She said, Mom, I'm worried about you. I think something is different since the surgery, and I want a second opinion. Will you come with me to see someone? There was a long pause. Her mother said, You think something is wrong with me? Maya said, I think something changed, and I love you too much to pretend I haven't noticed. Another pause. Her mother said, All right. Dr. Voss assessed Carol Ellison, a comprehensive battery of cognitive and neuropsychological tests. She reviewed the surgical records. She conducted an extended clinical interview. At the end of the 3rd session, she met with Maya, alone. She said, Your mother's core cognitive function is intact. Memory, language, reasoning, all within normal parameters for her age and the nature of her surgery. She said, however, there are measurable changes in her emotional processing and social cognition that are consistent with the location of the tumor and the surgical site. The left temporal lobe is involved in language processing, but it also plays a role in the integration of emotional memory and the recognition of emotionally significant social cues. She said, What this can mean, in practical terms, is that the emotional texture of social interaction may feel different to someone who knew the patient before the surgical intervention. The patient may process and respond to emotional content in ways that are subtly but genuinely different from their pre-surgical baseline. She said, You were not imagining it. Something did change. She said, But your mother is still your mother. The change is in a system, not in a self. Maya sat with this for a long time. She said, Can it be treated? Dr. Voss said, It can be addressed. There are therapeutic approaches that can help her rebuild some of the automatic emotional processing pathways that may have been disrupted. It takes time, it takes work, and it requires her cooperation. She paused. She said, "The fact that she agreed to come here because you asked her to, because you told her you loved her too much to pretend, that tells me something important about who she still is." Carol Ellison began working with Dr. Voss 2 weeks later. It was not a quick process. It was not a dramatic recovery. It was the slow, quiet work of a woman in her mid-60s, rebuilding something she had not known was broken, guided by a clinician who knew how to find the pathways and a daughter who came to every session she was allowed to attend. 6 months in, Carol mentioned the tomatoes without being asked. Maya did not say anything. She wrote it down later, on the list, but with a different notation than the others. 8 months in, Carol reached across the table and patted Maya's hand while she was making a point. 10 months in, she called her sweetheart, just once, in passing, the way she always had, so habitual that she didn't think about it as a word, just as a signal. "I am your mother. I love you. I am talking to you." Maya excused herself and went to the bathroom and stood at the sink for several minutes. Carol Ellison is 67 years old now. She tends her garden. She talks to Maya every day. She knows what happened to her. Dr. Voss explained it to her in the careful way that good clinicians explain things, fully, without minimizing, with respect for the person's right to understand what has occurred in their own brain. Carol sat with this information for a long time. Then she said something that Maya has thought about every day since. She said, "I could feel it. After the surgery, I could feel that something was different in how I connected to things. To you, to the garden. It was like looking at something I loved through glass. I could see it, I could recognize it, but I couldn't quite touch it." She said, "I didn't say anything because I didn't know how, and because I was afraid that if I said it out loud it would become more real." She said, "I'm glad you noticed. I'm glad you said something. I'm glad you didn't pretend." Maya said, "I couldn't. I loved you too much." Carol said, "I know." She reached across and patted her daughter's hand, the way she always had, the way she always would. This story is fictional and created for entertainment purposes only.